Tobacco-free Allegheny reminds you that smoking in an enclosed space like your home or car exposes the people you love, even your pets, to illnesses caused by secondhand smoke. If you're lighting up, step outside. Let us help you quit. Call 1-800-QUIT-NOW.
Hello and welcome to Healthy Living with Tobacco-Free Allegheny. I'm Joyce Petro, and today we'll be talking about the dangers of second and third-hand smoke and proposed legislation to reduce the public's exposure to this risk. Secondhand smoke is a mixture of the unfiltered smoke that comes from burning tobacco and the smoke exhaled by the smoker. Because smoke from a burning cigarette is unfiltered, it may contain twice the amount of tar and nicotine as the smoke that passes through the filter. Smokers aren't the only ones affected by smoking. Anyone who is exposed to tobacco smoke may be harmed by its toxic chemical components, including non-smokers, children, and even pets. Third-hand smoke is a relatively new term that describes the tobacco residue from cigarettes, cigars, and other tobacco products that's left behind after smoking and builds up on surfaces and furnishings and remains on our clothes after we leave a smoky place. It may seem like just an offensive smell, but it also indicates the presence of tobacco toxins. Breathing secondhand smoke increases the risk of developing heart disease, lung cancer, and respiratory problems. Children and the elderly are especially vulnerable to the effects of secondhand smoke. Anyone who already has heart disease or respiratory problems should be careful to avoid exposure to secondhand smoke. The Centers for Disease Control and Prevention says that secondhand smoke increases the risk of heart disease by 25 to 30%, increases the risk of lung cancer by 20 to 30%. It irritates the eyes, nose, and throat, worsens asthma, allergies, and bronchitis, causes headaches and nausea, and it places babies exposed to it at higher risk of dying from sudden infant death syndrome. In 2008, Pennsylvania became the 28th state to adopt legislation prohibiting smoking in public places and most workplaces. But the law includes numerous exceptions, causing thousands of workers to continue to be exposed to secondhand smoke at work. Pennsylvania Senator Stewart Greenleaf of PA District 12 says there's room for improvement, and he has introduced Senate Bill 567 to address this issue. We'll be talking with Senator Greenleaf today about his legislation. We'll also be talking with Deborah Brown, President and CEO of the American Lung Association of the Mid-Atlantic, about how local advocates can get involved. This is Joyce Petro of Tobacco Free Allegheny. How are you today, sir?
Okay, fine with you.
I'm good, thank you. Thank you for joining us today.
My pleasure. Thanks for inviting me.
Senator, as you know, Pennsylvania has a clean indoor air law. Why did you introduce a new bill?
Well, I've introduced, let's go back to the original concept. We were able some years ago now to introduce a bill that covered a substantial portion of the population of Pennsylvania from exposure to secondary smoke, which is a deadly substance, and I think everyone probably knows, but hopefully if they don't, that there's numerous carcinogens and chemicals that are very, very toxic, one of the most toxic chemicals in the world. And so we protected many, many facilities, and I think the studies would indicate that there have been significant reductions in those chemicals and in the clean air that people are now exposed to. Unfortunately, though, in order to get that legislation passed, we had to make some compromises that allowed some other locations and other establishments who are very powerful lobbying groups, or to allow some exceptions. And we would not have been able to pass the legislation without making those exceptions at the time. my belief is that we move forward. If we had not moved forward, then we would have not had any Clean Air Indoor Act in Pennsylvania, and we've saved many lives and cleaned up the air significantly. I think some studies would indicate as much as 90 percentile in various areas. But that doesn't mean that we don't continue on and come back and fight another day, and this is that day. And
so what is
this is why I introduced the Senate bill to remove those exceptions.
So what is different in this bill?
I'm sorry?
What is different in this bill from the original bill?
Well, the subject matter isn't any different, but the law that passed had those exceptions in it, and those exceptions dealing with some drinking establishments, not all, some of them are covered by the legislation that we passed, and it's a law now, the Clean Air Indoor Act, but some of them, based on their sale, the percentage sale of food as compared to alcohol, so licensed gambling facilities, private clubs, residential facilities, fundraisers, tobacco promotion events. All those were exceptions, and so this bill would remove those exceptions, and so that we would have 100%. And now there are people who, for example, work in casinos that are exposed to secondary smoke, even though they prefer not to. But that's their job, and we know today it's difficult to find other jobs. So, and also the patrons are exposed to that's secondary smoke as well. So this legislation will zero in on those exceptions, and hopefully we'll gather, now that it's been shown that basically kind of like scare tactics that were used to say that they're going to destroy businesses if we pass this legislation, because we do have some regulations on drinking establishments, for example, and some on gambling and the gambling facilities too as well, and some private clubs and. Well, the bill doesn't leave them alone. There are restrictions on those facilities, but they're not absolute 100% restrictions, and that's what we're looking for in the new bill. But it has not had the destruction of their economy or their economic well-being, and we haven't had all types of businesses shutting their doors. That's not what happened. In fact, there was a study recently that specifically found that on the effect of the Clean Indoor Air Act, the air quality in the hospitality industry did not have a significant impact on their economic condition of that industry.
Does the new bill include prohibitions on electronic cigarettes or e-cigarettes?
It does. And in fact, I've also introduced a separate bill on that as well, in hopes that if we don't get all that we want in this bill, the Senate Bill 567, then we can at least have coverage and regulation of this as a tobacco product. That's what we're dealing with. As far as I'm concerned, that's the most important aspect of it. Is it a tobacco product that's being used? And it is. And so I'm hopeful that we'll get some type of legislation passed that makes sure, for example, basically that we don't sell them to her children. And that's a type of protection.
Have other states passed similar legislation?
My understanding is that they have. I think most of the states do have exceptions, though. In all their legislation, they had to make some compromises, and that's the democratic process that we go through. And in this case, there were some very powerful industries that were being, they thought, adversely affected, when in fact the statistics show that the industry would not be adversely affected, maybe, except other than the tobacco industry.
If anyone would like to support this bill, what should they do?
Well, they should contact their state legislator, House and Senate members, and let them know about their concerns, and let them know that we want our state to be covered by the Clean Air Act 100%.
Okay. Senator, is there anything you'd like to add before we leave today?
No, I think that pretty well covers it. And I also want to thank the various agencies that have been involved in it, the American Lung Association, Heart, Cancer, all those that have been involved, and your group, all the groups that are involved in this health issues that we're concerned about. Clearly, there's no doubt now, because of the U.S. Surgeon General's reports that have been issued over several decades, that clearly, no doubt about it, that secondary smoke is deadly. It's like going around spraying cyanide in the air in people's faces. It's a very significant health danger and concern, and we need to continue to advocate for it until we make Pennsylvania 100% clean indoor air.
And we thank you for your leadership role on that issue.
Well, thank you so much. Thank you for all that you've done.
Thank you, Senator. Have a good day.
You too.
This is Brittany Huffman of Tobacco Free Allegheny. The Pennsylvania Department of Health and PIAA remind you that athletes who compete at any level must be in top physical condition. Smoking tobacco products will ruin your game. Remember, champions light up the scoreboard, not cigarettes. For more information on help with quitting, contact TFA at 412-322-8321 or visit tobaccofreeallegheny.org.
Mark Twain once said, "Quitting smoking's easy. I've done it 1,000 times." Quitting is hard because nicotine is addictive, but the right combination of support and advice can help. If 2015 is your year to quit and stay quit, even if you've tried and failed before, let the Pennsylvania Free Quit Line help. Smokers who use a quit line are twice as likely to be successful quitting as those who don't. Call today 1-800-QUIT-NOW.
My next guest today is Deb Brown, President and CEO of the American Lung Association of the Mid-Atlantic. Welcome, Deb, and thank you for being with us today.
Well, thank you for having me. It's nice to be here.
Can you tell us what benefits have been seen since the Clean Indoor Air Act was passed in 2008?
Sure, I'd be glad to. The Pennsylvania Clean Indoor Air Law has really seen numerous positive benefits and really is supported nationwide. Residents are even now starting to demand that recreational areas or exits and entrances outside become smoke-free, particularly where there are young children who are very susceptible to lung issues related to secondhand smoke. But some of the key findings that we have as a result of the Clean Indoor Air Law include no negative impact on full or limited service restaurants and drinking establishments. There was an 87% decrease in air pollution found in pre and post tests that we did on air quality regarding the Clean Indoor Air Law. 82% of surveyed Pennsylvania voters supported clean indoor air legislation, and 77% of Pennsylvania adults believed that the Clean Indoor Air Law had a positive effect on Pennsylvania's image. So there's a lot of positives that are happening, and we're hoping that we can even make the law a little bit stronger so that more individuals can be protected from secondhand smoke.
Yes, as you know, Senator Greenleaf has sponsored new legislation to improve the Clean Indoor Air Act. How will local tobacco control advocates be able to get involved?
Sure. Local tobacco control advocates can really become involved in the American Lung Association of Pennsylvania's annual Advocacy Day. And we are going to be holding that day on May 5th this year, so it's coming up from 7:30 to 12:30 at the Pennsylvania State Capitol. And our goal really is to protect Pennsylvanians from secondhand smoke, and we really want to support those who want to quit, and we really need to look at preventing young people from ever starting so that we don't have to help them quit.
So what type of people participate in advocacy?
Sure. We will have a variety of participants joining us that day. We will have advocates from across the Commonwealth. We will have what we call TRUE members. TRUE is something that is our youth tobacco control movement. It's Tobacco Resistance Unit. And so we should have probably about 225 to 250 individuals joining us at the Capitol that day.
Who will be involved from our local area?
Sure. We will have UPMC, the Washington Drug and Alcohol Commission, Tobacco Free Allegheny, Northside Leadership Conference, ACRP, students from the Keystone Wellness Program. So there will be a variety of individuals joining us, but we are particularly excited about our young people who are joining us. As I said, the TRUE members, the Tobacco Resistance Unit, is really a movement throughout all of Pennsylvania, and we're working with youth ages 12 to 18, and we're helping them to stay tobacco and nicotine free. And it's really, the project, the TRUE project, is really aiming to prevent and stop young people from using tobacco through education. So what we're going to have them do on this day, on our Advocacy Day in May, is to have a personalized photo of a loved one who has been affected by lung disease in some way, and we'll be completing a memorial activity throughout the day. And our goal is to show that behind every photograph there's really a story that needs to be told. And we're hoping these young people can help us do that. And they're going to take their pictures throughout the state capitol complex, and they're going to have a checklist of iconic places where they visit, and they help really tell the story to our legislators about the importance of protecting everyone from secondhand smoke. They're also going to post the pictures through social media outlets like Instagram, Facebook, and Twitter. And so, as I said, we'll have people from all 8 health regions in the state, and it'll probably be about 225 to 250 people attending.
How can our local teens get involved in TRUE?
Well, certainly they can sign up. There's a website that they can, true.inpennsylvania.org, or they can go to pactonline.org, and that will take them to the TRUE site so that they can sign up and become a member. They'll receive information, and they'll learn more about the activities that are actually happening throughout the Commonwealth, not just in May, but throughout the entire year.
If an individual is concerned about this law or Advocacy Day, what should they do? Should they contact their legislatures, or can an individual be involved in Advocacy Day?
An individual can certainly be involved in Advocacy Day. We're getting to closer to our capacity, so we would ask them to go to pactonline.org, pactonline.org, to sign up. But yes, even if they can't come to Harrisburg for the day, it's really important that people contact their legislators, their elected officials, and let them know their story. Why does secondhand smoke personally affect them or a loved one? And really make sure that the legislators know there's constituents back home who are directly affected by this, and really want them to make sure that no one has to breathe in secondhand smoke, because we do have a lot of exemptions in this law, and it's unfair for those individuals to have to be exposed to secondhand smoke every day at their job.
Do you know if there's strong support among the legislature for Senator Greenleaf's bill?
There is support. We have, working through all of our local coalition members, we have been talking with legislators, and there is support. from numerous legislators. We still have a lot of work to do. There's a lot of newer legislators, so we need to make sure that we're educating them about the concerns regarding secondhand smoke exposure. And so I think, we're heading in the right direction, but we still have a lot of work ahead of us to make sure that we have legislators fully understand the ramifications of the exemptions in the law.
Is there anything else you'd like to share with our listeners today regarding this proposed legislation or the Tobacco Resistance Unit?
I would hope that everyone would contact their legislators. And as I said, people are now demanding other locations be smoke-free. And so we need to make sure that some of these exempted areas really have completely smoke-free environments for employees. We often say that no one should have to choose between their job and a paycheck as a result of exposure to secondhand smoke. And as for True, we are always looking for young people who want to advocate for smoke-free environments and who want to help anyone and everyone with tobacco control-related issues. So if anyone is interested, it's an exciting group of young people. There's no criteria. Anyone can be involved, and we just ask that you sign up.
Okay, thank you very much, Deb. Thanks for being with us today.
My pleasure. Thank you for having me.
Mark Twain once said, "Quitting smoking is easy. I've done it 1,000 times. But quitting is hard because nicotine is addictive. The right combination of support and advice can help. If 2015 is your year to quit and stay quit, even if you've tried and failed before, we can help. To learn more about our program, call us at 412-322-8321 or visit tobaccofreeallegheny.org.
This is Brittany Huffman of Tobacco Free Allegheny. The Pennsylvania Department of Health and PIAA remind you that athletes who compete at any level must be in top physical condition. Smoking tobacco products will ruin your game. Remember, champions light up the scoreboard, not cigarettes. For more information on help with quitting, contact TFA at 412-322-8321 or visit tobaccofreeallegheny.org.
Here with me now is my colleague, Seal Victor DeSando. Seal is the Prevention Manager at Addiction Medicine Services at Western Psychiatric Institute and Clinic of UPMC. Hi, Seal. Thanks for joining us.
Hi, Joyce. Thanks for having me.
In addition to the clean indoor air legislation that we've been talking about today, we've seen that many work sites are introducing or revising their policies regarding tobacco use. Could you tell us about that?
Well, one of the things that you mentioned earlier was the dangers of secondhand and third-hand smoke, which is why we want to have clean indoor air so that workers are protected. One of the things that work sites are doing, or they want to protect their workers, but they also want to protect anyone who comes into their building. So, for example, one of the things that UPMC has done is when they revised their tobacco use worksite policy, they revised it a year ago, July 1st, 2014, and they revised it to go to what they're calling tobacco-free or smoke-free shifts. And this would be that any employee or contractor or vendor cannot smoke while they are on the campuses of UPMC. This protects any family member, any patient, anyone who was there from being exposed to those toxins or carcinogens, particularly vulnerable populations who may have a cardiac or a lung disease or even something like a sensitivity to smoke. So medical centers and healthcare facilities are doing it, but a lot of other work sites are trying to make sure that everyone is as comfortable as they can be so that they can be as productive as they can be at their work sites.
So do these policies generally include newer devices that we're seeing, like electronic cigarettes or e-cigarettes?
Well, the American Lung Association recommends that they do include those. One of the things that any policy will have in it is a definition of what a tobacco product is. And a definition of a tobacco product usually includes that it has nicotine that is derived from the tobacco plant. The nicotine that's in electronic devices is derived from the tobacco plant, so would be covered under a tobacco product. The Food and Drug Administration is looking at regulating electronic cigarettes and regulating them, number one, so that we do know what's in them. And also there's research being done as to actually what's in the vapors that are emitted from an electronic cigarette. And since we know certain things are emitted, such as carcinogens and heavy metals, such as lead and nickel, we know that those things are not safe for bystanders to breathe in. So the American Lung Association is recommending that they be included so that we don't have to backtrack and try and make someone safe later on, and we can start doing that as we're revising policies now.
If there's someone who's responsible for a work site or part of a team that's responsible for a work site that's interested in revising their tobacco policy, what do you recommend that they do?
Well, one of the things that Tobacco Free Allegheny is sponsoring, and we at Addiction Medicine are doing the implementation of it, is writing a tobacco-free worksite policy workshop, and it's going to be held on May the 14th, and it will be free, and it will be held at Road F. Shalom in Shadyside. And for someone, if they want information on that, they would contact Tobacco Free Allegheny. But what we would recommend is we ask the human resource managers, could be folks who are part of an employee assistance program, to come bring their policy. It will be an interactive day. We'll have resources so that folks can address all of the stumbling blocks and the hurdles that they might be worried about with this. We'll also look at how do you help your employee who has to be smoke-free during a day. How do you make sure that they are comfortable and that they're not feeling any kind of triggers or cravings if they're not able to smoke while they are at work. So there will be resources, and we'll also have other organizations there who have revised their policy so that they can share what worked for them and what might have been a little bit difficult.
Thank you very much, Seal. Thanks for joining us today on Healthy Living with Tobacco Free Allegheny. You're invited to listen to this broadcast by visiting www.tobaccofreeallegheny.org.
Tobacco Free Allegheny wants you to know that if you smoke and you use the telephone quit line, you're twice more likely to be successful in your effort to quit than those who don't call. We want you to be successful. Call 1-800-QUIT-NOW.